Hello, everyone, and thank you for joining us today for this special Medscape feature on reproductive rights and how this affects neurology. So I'm here this afternoon with Dr. Lahue, who's a neurologist at UCSF, an assistant professor of neurology, and recent first author of a viewpoint in JAMA Neurology entitled Reproductive Rights in Neurology, the Supreme Court's Impact on All of Us. So, obviously, most of us are aware that about this Supreme Court decision and abortion care, reproductive rights have been all over the news over past months. But as a neurologist, I'm curious what got you motivated to write about this topic.
So thank you for having me to talk about this important topic. I was very upset when the initial draft came out of the draft of the Supreme Court decision. And really within a day or so, assembled a team of other neurologists to talk about what we might do to raise awareness around this issue. And I think it's very important that neurologists speak up about abortion and about reproductive rights in general, just because we have patients who also require this type of care. And neurologic health is inextricably linked to reproductive health. And so really within the first few days that draft was leaked, we ended up drafting our own viewpoint for JAMA Neurology. And really the hope is that we can show that this is a topic that really is so wide ranging. It's not just something that affects our colleagues who are in OB-GYN, but this is something that can affect really all patients.
Yeah, thank you so much for explaining what motivated you to write this piece. Could you expand a little bit further on the intersection between women's health and neurology, especially related to birth control and abortion access?
One of my main interests in this area really began with discussions around medication use. Just because there are so many medications that we prescribe as neurologists for a variety of medical conditions, which I'm sure we'll talk about in more detail. And those recommendations change depending on what someone's family planning goals are. And so it's very important that neurologists are aware of risks around birth defects and other reasons why medication might be teratogenic, but also just to be aware that for the vast majority of medications that we prescribe as neurologists, we really don't have data about birth defects just at all. And so this becomes a really important topic as a neurologist who might be prescribing medication to someone who is interested in becoming pregnant or who has the capacity for pregnancy, just because the decisions around what medications are appropriate might be adjusted based on those discussions and what those goals are. And so I think to speak more concretely, there are medications that we might prescribe that can cause birth defects, things like methotrexate, which has been in the news recently, and many others. And so it's recommended that someone be on birth control if they have the capacity to become pregnant, if they're on a medication that can cause birth defects, but no method of birth control is going to be 100% effective. And so it's very important that we have these conversations with our patients about the need for birth control, but also just to acknowledge that there are times when access to the full spectrum of reproductive health care, and that includes abortion, might be necessary when treating patients with neurologic disease.
Absolutely. And I think that everyone might be aware that there's been really an explosion of new medications for conditions like epilepsy and MS that have vastly expanded our ability to treat patients. But yeah, so could you maybe explain a little bit more in detail? Let's say there's a young woman with multiple sclerosis, how your treatment decisions might be changed if we practice in a state where access to abortion might not be available. How would that, in practical terms, change a treatment decision?
Absolutely. I think the concern is that that there may be some changes in practice. And I know that there are some groups who are looking at this nationally to see if this is indeed happening. But I think for the example that you have, let's again take this discussion around birth control. Again, if we're going to prescribe a medication that's important for someone's epilepsy, oftentimes these medications can can increase the risk of birth defects, or we might not actually know the full gamut of what the harms are, and we just have to assume that there could be some theoretical risk. Again, there's no form of contraception that's going to be 100% effective. And I always find it really striking that there is some data to suggest that this is especially a problem for people with epilepsy. Even those who are taking hormonal contraceptives, just because sometimes the medications that we prescribe can actually affect the efficacy of the contraceptives themselves. So even in the best case scenario, when someone is using a hormonal form of birth control as prescribed, there is always that chance, especially if there's a medication we're prescribing that can affect its efficacy, that it's not going to be working as well. And so I was really struck by data that showed that when it comes to contraceptive failure risk for oral hormonal contraceptives, that's about 1% for the general population. But for women with epilepsy, that's more around 3 to 6%, which is just a striking difference. So especially for this population, it's important for us to think about how having bans around abortion access will affect these decisions around medications, if we know that that option is not something that's going to be available for these patients.
Yeah, thanks for pointing out that important data. Now, you also mentioned in your article that restrictions to reproductive rights may further widen health disparities and disproportionately affect women with lower socioeconomic background, as well as Black and Hispanic women. Could you tell us more about that?
So at UCSF, there's a longitudinal study called the Turnaway study that's based here. It's an incredible study. I recommend listeners of this have a look at the vast amounts of data that they've collected over the years when it comes to looking at the impact of abortion bans on a wide variety of topics, including socioeconomic status. They had a very, unfortunately, clever design, which was the basis for the name of the study being called Turnaway, which is taking a group of women who are seeking out abortion and seeing those who are able to successfully obtain that abortion, and then comparing them with those who are, for various reasons, turned away from receiving an abortion. And it's with experiments like, and I'll rephrase that, it's with studies like this that allow us to understand the economic impact of abortion bans and having this lack of access to abortion care. This group was able to demonstrate that while it is oftentimes women who are poorer who seek out abortion, and this is also from data from the CDC that we know this, that those who are unable to access abortion are further entrenched in cycles of poverty, that they are less likely to access jobs, they're more likely to stay within their socioeconomic status of poverty. So this is an example of these healthcare policies that are also having a dramatic impact on economic opportunities for women who may need this as an option in their reproductive choices.
Yeah, thanks so much for enlightening, and I'm glad this is being studied at your center. Now, to change gears a little bit, beyond our patients, access to reproductive rights may also affect decisions of physicians where to go into practice. Do you have any thoughts on how these changes yet to come might impact the physician landscape in different states in the U.S.?
Absolutely. I think it's important to remember that doctors are also sometimes patients, and an estimated 1 in 10 physicians have had an abortion. So while we are also those who care for patients who may need access to abortion, we are also part of a group of people who may also require it ourselves. And I think it's also important to emphasize that doctors also face more obstetrical complications than the general public. So in particular, there was one recent study in JAMA Surgery that showed that women surgeons have higher rates of infertility as well as pregnancy complications. And so then now imagine if you're a pregnant resident and you get invited to give a talk at at a conference that's being held in one of these states where abortion is banned, would you risk going to this conference? I think there are some very important questions to be asked here in terms of where physicians can feel safe living and practicing, not just with being mobile for attending conferences, but then also just thinking about where one is going to be forming the basis of their career. So I do worry that there may be a reduction in the number of physicians who, for them, this is something that's important in states where there are these restrictions in reproductive rights.
So yeah, so lots of important things to talk about, but you kind of finally was wondering if you had some advice on what each of us can do to support our patients and provide some practical resources.
I think this is where advocacy is an important thing to emphasize, especially in local elections, not just the national elections, to stay abreast of issues of what's on the ballot. So for example, there are some elections where reproductive rights are on the ballot, and it's very important to understand when that is going to be coming to your community. So that's one way in which one can take action and advocate for both oneself as well as for one's patients. And then I think also by joining other national organizations related to reproductive rights, but also just one's own medical society and physician society. I think that these are ways where physicians need to stay both active, but also remain vocal about all the concerns around these reproductive rights bans.
Thanks so much for putting out these practical steps. So thanks again, everyone, for joining us for this hot topics viewpoint on reproductive rights and neurology. And I encourage everyone to actually go to Dr. LaHue's article and read this yourself and expand a bit more on the points we talked about today. Thanks, everyone.
Thank you.